Hi, Cami. It's not as exciting as golf, but the Minnesota legislature is considering adding the state to an interstate licensure compact, which would make it easier for nurses from other states to come here and use their existing qualifications. I spoke with the president of the Minnesota Nurses Association, and he says while that expediency would be useful, there are some reservations with professional nurses around the state. One of the worries that the MNA has is that it could make it harder for the state to maintain quality of care for patients. And one of the ways that could happen is through maintaining consistent continuing education qualifications. Minnesota nurses are required to complete 24 hours of courses every 2 years, but continuing education hours vary from state to state, and in several cases aren't mandatory.
Nurse licensure compact isn't the solution for Minnesota's nurse and healthcare worker staffing crisis. The nurse licensure compact is really a race to the bottom that erodes Minnesota's independent ability to license and oversee medical professionals like nurses.
MNA President Chris Rubesh acknowledges that for larger hospitals like the Mayo Clinic, a compact like this could make it easier to move employees from state to state. But he says there are still other options for pursuing that here in Minnesota, such as seeking temporary permits for employees while they're awaiting recertification. Live in Rochester, Evan Berg, KIMT News 3.
All right, Evan, thank you so much. The Minnesota Board of Nursing currently has a 60-day temporary permit for out-of-state nurses to work in the state before they need to pursue recertification.